you touched on something that I think is really important for us to talk about today. This accelerated trend of virtual healthcare, and we're kind of living in this virtual first healthcare climate since the pandemic. What's your perspective on whether virtual care is effective, and is it really here to stay?
So the first part of your question is very hard to answer. There's tons of research. The numbers of papers on virtual health in the broad sense of digital health are staggering, and some contradict the other. Some prove that it's true. The latter part, I think, is easy. Is it here to stay? Definitely. I recently was interviewed in one of the national newspapers, and I said, we've been pregnant for digital health for years, and now came to life through an acute C-section during this pandemic. And all of a sudden, everything worked. Nobody was asking questions, and within the weekend, we had to transform it, and everybody understood that, yes, there is a way that it could be a digital first and physical next. And sure enough, it's not applicable for everything. But prior to that, we hypothesized about what was working and not, and now we know. So now we know that for a couple of interventions and for some areas in healthcare, it totally does not work. And that's not only about diagnostics and stuff like that, but for instance, also in terms of specific areas of mental health and areas like that. So now we're well educated for that. And I think that the research that is going to come out in the next, let's say, 4 or 5 years on this is going to prove that.
Right.
The second part is that just bluntly ask patients, family and informal care, how they think about that. And the latter part I always like to mention in terms of virtual health, digital health, is the environmental issue. I've calculated for the Netherlands alone, we got a population of 17 million people. The number of outpatient visits, first-time outpatient visits in the Netherlands in 2015 were 8.8 million. And let's assume, which is 1/3, let's assume that everybody would take his car. That is as much as 91 million kilometers that somebody burns fossil fuels probably to go back and forth to the hospital only for a consultation.
Yeah.
And sure enough, there was a couple of those that would be needed, but there's all kinds of aspects where digital health really could bring something into the mix.